Hello everyone, you're listening to Talk Recovery Radio. I'll turn that down a bit. We come to you live every Thursday from the downtown east side at Vancouver Co-op Radio 100.5 FM, and we're at Columbia and Hastings. We just finished interviewing Jason Howell talking about recovery-oriented systems of care, and now we've got Travis Lupik who's going to be joining us. He's a writer for the Georgia Straight, and we're going to be talking about his new book, Fighting for Space, and there's going to be an event taking place. It's the launch that's taking place?
November 16th.
November 16th. So we're going to get into that. We're going to take this 80s track down a bit. And you're listening to Talk Recovery Radio, and Darren's got an 80s theme going today. We just had some Glass Tiger, and now AHA with Take On Me. Thank you, Darren, for bringing us back to the 80s. We were all reminiscing about Much Music a little while ago during our first break, and I used to have long hair back then. So we just finished interviewing Jason Howell. He was talking about recovery-oriented systems of care down in Texas and what that looks like. So thanks, Jason. You can catch that on our SoundCloud, later on our Facebook page, facebook.com/TalkRecoveryVancouver. We've got a great guest in studio today. Francis is going to be interviewing him, and I'm looking forward to his conversation and an event that's coming up pretty soon. So Francis, I'm just going to head on the mic over to you.
Thanks, Giuseppe. So I get the pleasure of talking to Travis Lupick today. He is a reporter for the Georgia Straight. You've been a reporter for them for like 10 years?
Off and on for 10 years now.
Yeah, and so you began with them when you were like 15, 16?
Loading trucks, yeah.
So you're only like 25, 26?
I'm 32.
Oh, okay, I'm really bad at math. Isn't that like 10? No, okay.
It doesn't matter. It's not a math show.
Okay.
I've been there for a long time.
Okay, I'm like, what? Hang on. Okay, so anyways, despite that, although I'm going to come back to that, I think, in my own time. But yeah, so you've worked for them for a long time. So you're really young to like write a book.
I don't know. I guess I could be.
Yeah. So so you worked for them, and then you've been in the downtown east side, and that's been a part of what you've been writing about with the Georgia Straight, correct?
Yeah. Since the fentanyl crisis really picked up, that's pretty much become my full-time beat for the Georgia Straight.
Okay. And then, so where did you get interested in it? Where did you become like passionate about the downtown east side?
I was living here, and the overdoses picked up, and it, as a member of the community, it became impossible to ignore how many people were dying.
Okay, so you're living. Are you still living in the downtown east side?
I am, just a block from here.
A block from here, so that's how you were able to come so quickly. You're like, "Why don't we just come down?" I'm like, "Oh yeah, that'd be great." Okay, so so what's it like to live in the downtown east side while all this stuff is happening?
That phrase that I used a second ago, it became impossible to ignore. There's one morning I remember where I was waiting for my bus to work, and there was a body with a sheet over it next to me. And coming home later, a different evening, walking by EMTs responding to an overdose, it was impossible to ignore.
So how do you live in it? Like, how? How do you reconcile that with like?
Well, I guess I don't really have a choice. I can't afford rent anywhere else in Vancouver.
Right. So that's why then. Is that because I think what people see when they see the downtown east side is they don't necessarily see the people that are working and students and all this sort of thing. They see what they see on the streets.
Yeah, I mean, I love this neighborhood though. It's a community that takes care of itself, and then that's really something I tried to highlight in the book.
Right. And so what is the story of the book?
So we're in the middle of an overdose crisis, but Vancouver's been through something like this crisis before. A lot of people will remember in the 1990s, early 2000s, when we suffered through Vancouver's first overdose epidemic. And similar to what's happening today, it was really activists living in the downtown east side who led Vancouver's response to that crisis. I felt, as we head into another crisis, that it might be time to recount that story.
And what is that story?
You had these amazing people, two women really. Liz Evans, who founded the Portland Hotel Society, and we're actually in the Portland Hotel Society building right now, I think.
Yeah, we are.
And Anne Livingston, who co-founded the Vancouver Area Network of Drug Users. They sort of started off on their mission separately, but their paths crossed a lot over the next couple decades. They said, we're going to start involving drug users in drug policy, kind of a revolutionary idea at the time. And Liz Evans with the Portland Hotel Society said, we're going to give people a home, and that home is going to be unconditional, which was, it's hard to sort of emphasize how different that was at the time. People were kicked out of social housing for if they were found with drugs, anything like that, outrageous behavior. Liz said, she told her tenants, this is your home now, and this is always going to be your home. You're not getting kicked out.
Is that realistic for a solution? Is that the Housing First solution?
So that was Housing First more than a decade before we called it Housing First.
Housing First, okay.
That's a very fashionable social policy that I'm a big advocate for.
Okay.
It says give people a home and then you let them work on the rest of their issues. Liz Evans was doing that back in 1991.
Okay, I've seen some reports regarding the Housing First initiative, and just about that some people have felt that some people have been placed in housing and then not given any supports. And so when somebody comes in off the street, so I remember one particular article I saw where a homeless person had been brought off the streets, but because of the mentality of like keeping everything you own and not throwing anything away and all that kind of stuff, the apartment had become really overrun with like garbage and stuff. So is there...
Well, Housing First comes with challenges, but and ideally you definitely would want it with the supportive services, wraparound services like you mentioned, help with counseling if that's needed, help with employment. But if the issue is addiction, what we're talking about today, I think even without support, Housing First makes a huge difference. Addiction is often a response to stress, and living on the streets is incredibly stressful.
Yeah, I can agree with you there. So I'm wondering, even as I'm walking to the station today, I'm just looking at the downtown east side, and I agree, it's a beautiful city. Like, it's like, I look at the Lotus Hotel, and I look at I don't know what it's called, but when you walk into Chinatown, it's just that gorgeous, like, it's just like, it takes my breath away. It's beautiful, right? And then, and yeah, I think, like, are we going to create a city where people we just accept that they do drugs, and then we just try to help them do it safely? Like, is that where you think we should head, or we are heading?
Well, it depends what you mean by accept that people do drugs. People have always done drugs.
Yeah.
I just learned today, actually, I met with a researcher with the BC Centre on Substance Use, and he sort of gave me an education on drug use back in the 1600s and even earlier, and he taught me that the word symposium comes from a Latin word that actually meant to get people together to drink. So people have always enjoyed vices. I think as we progress in healthcare and try and become a more progressive society, it's worth looking at how people can use drugs incurring less harm.
Right.
If we're always going to do drugs, if we accept that we've always done drugs, let's talk about how to do them safer.
Is it kind of like the argument people say about Americans and their guns? Like, it's like, I've heard this argument of don't try to take their guns away, just monitor their bullets. So is it like, do you know what I mean? Like, do you see my point? Like, okay, so like, we won't take your drugs away, but instead of these drugs, we'll give you these drugs. Like, almost like different bullets.
Well, I think we should take Americans' guns away. They're not acting really responsibly with those guns lately.
Maybe not the best metaphor, I don't know.
I guess it depends on where in a person's trajectory with addiction you're talking about. Addiction or drug use usually begins as a choice, sometimes in a response to trauma, but sometimes not. But later in an addiction, that choice has kind of been stripped away. And then I don't really see the purpose of criminalizing and further punishing somebody whose actions don't include a lot of free will anymore. Right.
And then, what are your thoughts on federal NDP leader Jagmeet Singh saying this week that drug addiction should be treated as a social justice issue, not a criminal justice issue?
Yeah, I actually took a walk with Jagmeet right through this neighborhood when he was in Vancouver on last Thursday. He had a lot of interesting things to say that I thought was really brave for a federal politician to say, because it's risky to say the things that he's saying. He's saying that we should decriminalize personal possession of all drugs, including cocaine and heroin, completely remove criminal penalties for personal possession of cocaine and heroin. That's something that the Conservatives have, of course, ruled out long ago, but that's also something that the Liberals and Justin Trudeau have entirely ruled out as well, so it's a risky position he's taking. I think it's a great start. I think it would go a long way in reducing stigma and lowering barriers to treatment. I pressed him, though, on why he favors decriminalization as opposed to full-on legalization, including regulation and bringing supply out of the hands of organized crime and under the control of the government. He won't go there yet. He said one step at a time. But I think those even more radical conversations are conversations we need to start to be having in the context of fentanyl really poisoning Canada's drug supply.
Right, and I think it's interesting, you know, BC is interesting. I think we're kind of a rare sort of breed or something, and for like the federal NDP leader, for that to be basically like his first statement after being elected, like that's a big deal and huge risk, I would agree. And there's other risks that are being taken politically, like within the political climate of British Columbia, where I don't know if they would fly in other places. And another one is Riverview, and have you heard of the potential for Riverview to become a possible solution or housing solution or some kind of solution for the downtown east side?
I think a campus they call it, because it's a little bit of a mix for everything. For those who don't know, Riverview is sort of a stereotypical mental institution that you see in movies that sort of go back to the 1900s. They film a lot of horror movies there today, actually, because it fits the part. Riverview closed in 2012, and now we're sort of revitalizing it, looking at creating a mental health campus, they call it. I think it needs to be a part of what we're doing. Through the 1970s, 80s, Vancouver was part of all of North America's deinstitutionalization push, emptying the asylums, to put it bluntly. Other jurisdictions, however, took some next step. Wasn't always positive. For example, the United States basically just threw everybody with a mental illness in jail. BC really just did nothing, and so you get so much mental illness we see here on the downtown east side. So I think it's positive that we're finally doing something with Riverview and going back, at least in that direction for some people. It needs to be a tool in the toolbox, and with these problems we need as many tools as we can get.
I would agree. And your book, Fighting for Space, is launching, well, it's launched November 1st.
It's out in stores. But we're doing a public launch November 16th.
November 16th, and where is that launch?
Excuse me. Beaumont Studios, around 5th and Canby.
And is anyone welcome?
Everyone's welcome. Public event. It's on Facebook. Search Fighting for Space on Facebook, and it should come up.
Very cool. And so I want to ask you another question just about abstinence-based recovery. Like, do you think that abstinence-based recovery and harm reduction are sort of like on the same continuum, or are they serving different clients, or are they opposing forces? Like, what?
I think they're absolutely complementary. I think that abstinence is quite obviously the best way to go. No drugs are better than drugs, but not everybody's ready for no drugs, and you want to keep them alive until they are ready for no drugs. And with how dangerous, especially an opiate addiction, but also increasingly cocaine addiction has become, fentanyl really contaminating everything these days. It's become more challenging to keep people alive long enough to get to abstinence. So I think harm reduction's really got to be a part of that to allow people to get there.
So with that comment, we approached the Minister of Mental Health and Addictions, Judy Darcy, to say there's a crisis, not only just for the overdose crisis, but there's a treatment crisis going on in British Columbia. And what's happened is with the BC Centre on Substance Use mandate their mandate is simply harm reduction for substance use disorder. And so I work for Last Door Recovery Society. I'm around the recovery community a lot, where we've noticed a divide now where if you have money, you can go to a private treatment center, which the goal is abstinence. But then if you're on welfare, or you're coming out of the downtown east side, or you just don't know how to access funds to go to treatment, all the beds in British Columbia now are simply harm reduction. It's actually unethical to consider abstinence in recovery. So we're asking the harm reduction community, for example, you're fighting for space for the substance users and drug users, and I think we need to decriminalize drugs. I think we need prescription heroin. I think we need more consumption sites. But what do you think happened? Because you've been around for so long. What do you think happened in the conversation where it's turned into the us and thems? So if I go to one individual person and say, you know what, abstinence is part of the continuum of care, you always get the same answer, yes. But when you get a group of people, you never get the conversation of recovery coming from the health authorities. So how do you think we lost that fourth pillar?
Yeah, the answer is money.
Money?
I think that there might be some jealousy aimed towards harm reduction from the treatment community, etc., because all the money appears to be flowing into harm reduction right now.
Yeah.
But the reason that's happening is because harm reduction is cheap. The overdose prevention site that's just across the street from us here was running for months on a GoFundMe page. They stole electricity from the bank next door, and they ran that thing on a few $100s a month.
Yeah.
And they saved lives every single day doing that. That's how cheap harm reduction can be when you strip it down. You can run an injection site on a few $100s a month. Treatment is incredibly expensive. You need dedicated buildings, full-time staff, and our provincial government has shown for a long time now it is not willing to invest in treatment.
So I'm talking to Ann Livingston, who we had a meeting here actually 2 weeks ago. We're trying to figure out how we can all be on the same page, because I understand it's money, but like, for example, a funded treatment center gets $40 a day from the government, and it hasn't increased in decades. And it's the only illness where money becomes an issue. Like, I went to the doctors, I got diabetes, I was told to stop eating sugar, I was given all this care. No one asked me what my income was. But when I have addiction, like, they actually ask you, there's a means test for addiction, like, do you qualify for welfare, do you own a car, it's absolutely insane that addiction is the only disease where we actually see what kind of funds you have and whether or not you can pay or not. And so I'm trying to figure out a way where, you know, we're fighting for space for the drug users, we're fighting for space for the people in recovery as well, you know, trying to get us all on the same page. So if somebody wants to go from harm reduction to abstinence, there aren't all these unique lenses. And if somebody from abstinence wants to go to harm reduction, then it's the same thing. Like, you have the choice to bounce back and forth. We can't answer that question today, that's for sure, but I'm glad that you said it's money, because it's unfair that it's money. It's the only disease where money becomes the determining factor where you go to treatment. I've seen opiate addicts that have money that are just as bad as somebody using in the downtown east side, and they go to treatment and they get well, right? Even just the gentleman in the door sleeping here right now. I mean, if we could say, hey, you want to go to treatment, you know, what would happen? And we can't do that. So I'm hoping we don't lose that conversation. So what's going to take place at your event on is it the 16th?
November 16th.
Yeah. What's going to take place?
Well, the book covers events in the downtown east side in Vancouver from about 1990 to 2016. We're going to use the public launch to take the conversation forward beyond 2016. So we have the mother of a drug addict. We have members of the provincial government's healthcare system. We have a couple people from the nonprofit sector, executive director of the Portland Hotel Society. I'm going to put all these people in a room and in front of an audience and start to talk about solutions to the fentanyl crisis.
That's great. Have you considered having anyone from recovery in the conversation? Just consider. You don't have to answer. But it's just we actually went to the mayor's office. He had, you know, when the overdose crisis really took force. I think that was 2 years ago when he had his opioid. He had a meeting at City Hall and all that, and everybody on the panel was a substance user or part of. Dr. Patricia Daly was there, and so we just asked him, like, have you ever considered putting somebody that's recovered from opiate addiction, because they actually recovered? And he just gave me this look like, oh, you know, and just, you know, goes into the assistance world and who's in communications, and I just thought, you're the mayor. You know what I mean?
Here's what I'll say.
Yeah.
I wrote a book about harm reduction, so that's what I'm talking about this month. But with 1,500 people dying a year now, people should be absolutely screaming for a Marshall Plan for treatment in British Columbia.
Yeah, screaming from the top of the mountains.
Absolutely.
Yeah, where I worked, we presented numbers. 900 people called us in 90 days that couldn't access treatment because they didn't have funding.
No, you can't. I mean,
900 people. That's 900 people that actually picked up the phone, said, hi, I'd like to come to treatment. I have a substance use. Well, they don't say it like that, but that's how we say it. And it's just, you don't qualify for a funded bed in the Fraser Health Systems. And then you have to say sorry, like there's just nothing we can do. And we're screaming, you know, from the mountaintop as well. And I'm grateful that you're just bringing a voice to harm reduction as well with your book, because we are fighting for space. If you want to use drugs, use them safely, and by all means. You couldn't tell me to stop using drugs when I was using them. I was just like, people tried, and
that's the thing. It's really hard to get people to the point where they want into treatment. Yeah. So when they do get to that point, we don't need to make it this damn hard.
Exactly.
Right.
Yeah, and it is hard because you got unique lenses. Can you imagine telling somebody we'll call us every day for 3 weeks while you're doing crystal meth?
They just sold their phone for it.
Exactly, yeah. So we're on the same page. Anyone can go. There's a Facebook page called Fighting for Space. Where do we go from here? Say it?
Yeah.
Sorry.
Fighting for Space, the fentanyl crisis, and where we go from here.
Okay, perfect. And you can go to that. It's a free event, and you can search for Travis's book online. It's on Amazon, and it's a great book. So when somebody finishes reading the book, what's your goal?
We're living through an overdose crisis. Vancouver's been through this before. There's cities all across North America that are suffering the same thing. Let's try and save everybody a little bit at a time. Let's try, Vancouver made mistakes through the 90s and 2000s, but they learned from those mistakes. So let's try and save everybody a little bit of time and apply the lessons that Vancouver learned.
You know what? We've got a couple minutes left, and I've got an important question for you. So a lot of people are, if my phone's being used for Facebook Live, there's about 30 names on my phone, contacts that have all passed away. And I grew up in the 80s and the 90s going to gay bars, and I remember people dying. This is way worse, and people are connecting the two tragedies of deaths. But do you think the response to the overdose crisis should be the same as it was to the AIDS addiction? AIDS crisis, where it comes to medication and the bio aspect of addiction.
Yeah, we need to get there because more people are dying now than who died of HIV at the peak of that crisis. But of course, you'll remember it took a long time for Canada's healthcare system to pay attention to AIDS.
Yeah.
I just a couple nights ago happened to watch a movie the band played on, which was about North America's sort of early response to HIV, and it was a lot of people died before it was really addressed. A lot of people have died in this overdose crisis, so hopefully we're getting there.
I think that's a great connection of the AIDS virus and addiction, because I remember people blamed people with AIDS, like they deserved it. They did it to themselves. Like they should just they should die and just all die off, and then the problem dies off. And I've heard people say, like, mostly on Facebook. Okay, I guess I can't actually hear them, but like writing with a keyboard that they should that this is like population control.
Fighting for Space. We've got Travis in the studio. Thank you very much for joining us.
Thanks so much for having me.
And you can once again go to his Facebook page, and on Facebook, our page, facebook.com/talkrecoveryvancouver. You can find links to the book and links to the event. And thanks for everybody who's watching us on Facebook Live. We try to have a great dialogue about addiction and recovery, and also fighting for space for those that are using and want to still live. So thank you for listening to us. We're going to go to